As we mentioned earlier, a CDC advisory committee made up of experts from around the country are voting today on who should receive the vaccine first once it's approved. And one group could be high on the list. This morning, we're connecting the dots between obese Americans and a COVID vaccine.
An advisory committee to the CDC will recommend who should get the coronavirus vaccine first, and they could recommend obese Americans get priority. Let's connect the dots. It's expected that the very first people to get the vaccine will be healthcare workers, the doctors and nurses working on the front lines of this pandemic. Next up would be the elderly and people with underlying conditions that make them vulnerable to COVID-19. Experts say obesity is a major risk factor for contracting a severe case of coronavirus, meaning obesity could be included in the list of underlying conditions. So how much of a risk factor is obesity when it comes to coronavirus? A paper published over the summer found people with obesity were 113% more likely to be hospitalized with COVID-19, were 74% more likely to be sent to the ICU, and 48% more likely to die. While common side effects of obesity like diabetes and hypertension may play a role, researchers also suggest fat cells could also be to blame since they're more hospitable for coronavirus. Britain has already made a call on this issue. Its public health agency issued guidance saying morbidly obese people should be prioritized when the vaccine is released. They're included in the same at-risk group that includes weakened immune systems, asthma, and kidney disease.